Not all medications are created equal. Some drugs you can take on and off at your own discretion without any problems. But then, there are those types of medications that you cannot stop abruptly, or else you'll be faced with serious adverse effects. There are common drugs like aspirin, acetaminophen, and even paracetamol, which is often taken for fever and pain relief on an as-needed basis. These drugs you can stop use at any time, and they are generally safe enough that you can take them without a prescription from your doctor. The same goes with certain pain medications like ibuprofen and naproxen. You can stop use of these drugs at any time and not worry about the possible dangers of doing so. Then there are the 5 classifications of drugs that we are going to be talking about today. Welcome to your Wellness Journal and to our video on the top 5 medications you should not stop without talking to your doctor first. If you are on any of the medications we are going to discuss, please know that you should not stop any of these without talking to your doctor. The reason why? Stopping these abruptly or ahead of schedule can potentially lead to a host of adverse side effects, which can include heart attacks, convulsion, antibiotic resistance, and so much more. We've ordered these from least dangerous to the most, so be sure to watch through to number 1, and if you are taking that, it is very important that you don't stop doing so without orders from your doctor. Let's get into the video and start our countdown with a drug category we've all had to take at one point or another. Number 5. Antibiotics. You know, I completely understand the temptation to want to stop antibiotics once you start feeling like yourself again. Those pills can cause some unpleasant side effects like nausea or diarrhea, and it's easy to think, I'm better now, so what's the harm of stopping early? But here's the thing, even though your symptoms may have improved, that doesn't necessarily mean the bacterial infection is completely wiped out yet. The antibiotics need enough time to seek out and destroy all the bacteria making you sick. If you stop too soon, you're giving any surviving bacteria a chance to multiply and possibly come back even stronger than before. And that's where something called antibiotic resistance can develop. Basically, the bacteria that survive learn how to outsmart and resist the medicine, almost like they're evolving into superbugs. They can spread to other people and are much harder to treat. It's a real problem that's making some infections very difficult to cure with the antibiotics we have available today. So, as much as you might think that you want to quit your antibiotics early, it's really important to see it through for as many days as your doctor prescribed. That gives the medicine the best shot at wiping out the infection 100%. And don't be tempted to save the leftovers just in case for the next time either. You should always take antibiotics exactly as instructed for your specific condition. Of course, there are always exceptions to every rule. In some cases, like a simple urinary tract infection, your doctor might say it's okay to stop early if you're feeling totally back to normal. But for things like pneumonia, a skin infection, or a sinus infection, it's really best to take the full course to be on the safe side. We want to make sure you get completely better and stay that way. And that means listening to your doctor's advice when it comes to antibiotics. Even if you feel great, trust the treatment plan and take all the pills to be sure we knock out that infection for good. If you have questions about antibiotic use, comment it down below. We're happy to help. Next on our countdown is number 4, corticosteroids. Corticosteroids are powerful anti-inflammatory medications that we use to treat a wide variety of health conditions where inflammation is causing problems in the body. They work by mimicking the effects of hormones that your adrenal glands naturally produce, like cortisol, to reduce inflammation and calm down an overactive immune system. Some of the most common conditions we prescribe corticosteroids for include asthma and COPD, autoimmune diseases like lupus, vasculitis, and rheumatoid arthritis, severe allergies, inflammatory bowel diseases like Crohn's and ulcerative colitis, multiple sclerosis flare-ups, inflamed joints from arthritis or injuries, and certain cancers like leukemia and lymphoma. They are also given to patients who have had organ transplants in order to stop rejection. Like with antibiotics, it can be very tempting to stop corticosteroid use when you start to feel better. But, and I know you already know what's coming, you should not do that. Let me explain why. You see, when you take corticosteroids for more than a few weeks, your body gets used to that extra boost and starts making less of its own natural steroid hormones. If you suddenly stop the medication, your body doesn't have time to adjust and ramp its own production back up. That steroid shortage can make you feel pretty lousy. Stopping steroids too quickly can cause withdrawal symptoms like extreme fatigue and weakness, body aches and joint pain, fever, chills, and other flu-like symptoms, nausea, vomiting, and stomach pain, dizziness and fainting from low blood pressure, and intense pain in your muscles and joints. In severe cases, steroid withdrawal can even be life-threatening, causing an adrenal crisis where your body can't respond to illness or stress. It can sometimes even lead to seizures. The longer you've been taking steroids and the higher the dose, the more likely you are to have withdrawal if you stop abruptly. Your body needs time to slowly and safely taper down and start making its own steroid hormones again. That's why your doctor will give you a schedule to gradually reduce your steroid dose over time. This helps prevent withdrawal and gives your adrenal glands time to wake up their natural steroid production. So, even if you're having some not so fun side effects, don't stop your steroids on your own. Let your doctor know what you're experiencing and they can help you adjust your medication to get you feeling better while keeping you safe. Next on the countdown is another common medication category, and it's number 3, diabetes medication. Let's take a moment and talk about what diabetes medications are for. These are medicines that help control your blood sugar levels and prevent complications from diabetes. They work in different ways, like helping your body use insulin better or reducing the amount of glucose your liver makes. Again, like with every other medication on this list today, I know it might be tempting to stop taking your diabetes meds if you're feeling better or are experiencing some unpleasant side effects. But it's really important not to stop these medications without talking to your doctor first. Diabetes is a serious condition. In most cases, it's not reversible, meaning if you have it, you will most likely have to live with it for the rest of your life. This is especially true for those with type 1 diabetes, and it can also be true for people with type 2 diabetes. Sure, lifestyle changes can help manage blood sugar levels, but ideally, you should really not be without medication, especially if you are not monitoring your blood sugar levels on a regular basis. Stopping these drugs can lead to a host of problems which results from uncontrolled diabetes. These include nerve damage or neuropathy causing numbness, tingling, and pain, kidney disease that could lead to dialysis, vision problems, and even blindness, heart disease and stroke, foot problems that could result in amputation. Scary stuff, right? That's why it's important to work with your doctor on any changes to your diabetes medications. Don't make the decisions on your own. They can help you safely adjust your doses or switch to a different medicine if needed. In some cases, if your diabetes is well controlled, you may be able to reduce or even stop certain meds. But this should only be done under close medical supervision with frequent blood sugar checks to make sure you're staying in a healthy range. So please, if you're thinking about stopping your diabetes medications for any reason, talk to your doctor first. We mentioned neuropathy, and if that is of interest to you, check out the video linked in your screen now. The next item we'll discuss is related to number 3 because it is also a category of drugs used in the treatment of a lifestyle disease, and it's number 2, hypertension medication. Blood pressure medications help control your hypertension by relaxing your blood vessels, removing extra salt and water from your body, or slowing down your heart rate. These meds are a real lifesaver in preventing serious problems like heart attacks and strokes. It can be tempting to want to stop taking your blood pressure pills, especially if you're not having any symptoms or if you're having untoward side effects. But don't stop it without talking to your doctor. If you quit cold turkey, it can cause your blood pressure to spike back up to dangerous levels. That puts a lot of extra stress on your heart and blood vessels. Some of the problems that could crop up include chest pain or angina, irregular or rapid heartbeat, heart attack, stroke, and kidney damage. The risks can be especially high with certain blood pressure meds like beta blockers. These work by slowing down your heart rate and reducing the force of each beat. If you abruptly stop taking a beta blocker, your heart rate and blood pressure can suddenly shoot up. In some cases, that shock to your system could even trigger a heart attack or a dangerous heart rhythm problem. Other types of blood pressure meds can also cause issues if stopped suddenly. For example, quitting clonidine or methyl-dopa too quickly can cause a rapid rise in blood pressure along with symptoms like headache, nervousness, and tremors. The bottom line, even if you are feeling great and your blood pressure numbers have been good, it's not safe to stop your meds on your own. Your doctor prescribed them for a reason, to keep your heart and blood vessels healthy for the long haul. If you're having any trouble with side effects or if you're wondering if you still need to be on your meds, please talk to your doctor. Now, on to number 1, psychiatric medications. Let's talk about why it's important not to suddenly stop psychiatric medications like antidepressants, antipsychotics, mood stabilizers, and even lithium. Abruptly quitting these drugs can lead to some unpleasant and potentially dangerous withdrawal effects. Here's what you should know. When you've been taking a psychiatric medication for a while, your brain gets used to it being there. If you suddenly remove that drug, your brain has to quickly adapt, which can throw things out of whack for a bit. Some common withdrawal symptoms include flu-like symptoms, aches, chills, fatigue, nausea, vomiting, and diarrhea, sleep problems with vivid dreams, dizziness and vertigo, headaches, anxiety, irritability and mood swings, and even electric shock sensations. Quitting cold turkey may also cause your original mental health symptoms to come back, sometimes worse than before. With conditions like depression, bipolar disorder, and schizophrenia, abruptly stopping medication can increase the risk of relapse and even include suicidal thoughts. The safest way to stop taking a psychiatric drug is to slowly taper off under the guidance of your doctor. Tapering off involves gradually lowering your dose over the course of several weeks or months. This gives your brain time to adjust and minimize the risk of severe withdrawal effects. Your tapering schedule will depend on factors like which drug you're taking, the dose, and how long you've been on it. In general, medications that have been taken for a long time and at a higher dose need to be tapered more slowly. Antidepressants like Paxil and Effexor may require an especially gradual taper since they leave your system quickly. Never try to taper off psychiatric drugs on your own. Work closely with your doctor to come up with a discontinuation plan that's safe and manageable for you. They can help you weigh the potential risks and benefits. In some cases, it may be best to stay on medications long term to prevent relapses. I know the idea of withdrawal can be scary, but don't let it deter you from getting the help you need. When taken as prescribed, psychiatric medications can be invaluable tools for treating mental illness. And with proper planning and medical supervision, many people are able to successfully come off these drugs. The key is to go slow, stay in close contact with your doctor, and be kind to yourself throughout the process. If you have further questions about this, let us know in the comment section below. For more videos on health and wellness, consider subscribing to our channel and check out the playlist on your screen now. If you have neuropathy, we suggest clicking on that video about neuropathy. We are your wellness journal. Have a healthy day.